welcome to a new video. My name is Vijita, nurse instructor at Athena Coaching Center. Hope all of you are doing good. In this video, I am going to discuss questions which has been continuously asked for Prometric and DHA exam. And I have selected the questions from respiratory system. So this is the first question. A nurse is caring for a child with a diagnosis of cystic fibrosis and pneumonia. The plan of care include nebulizer treatment and chest physiotherapy. And the nurse should perform chest physiotherapy. So the question is, what is a better time for performing chest physiotherapy? What is the condition here? It is cystic fibrosis with pneumonia. Cystic fibrosis, it is a condition which basically affects exocrine gland. Usually, cystic fibrosis is characterized by exocrine dysfunction. This affects respiratory system and it affects the GI system as well as it affects reproductive and integumentary system. I have explained cystic fibrosis in the previous video, so I will just place the link in this comment box. Fine. So a client with cystic fibrosis as well as pneumonia, where what is the treatment? Plan of treatment is nebulizer treatment. What can be the importance of giving nebulization for this particular patient? Because as I said earlier, cystic fibrosis is a condition in which that affect the respiratory system. Whatever the condition in which that affect the respiratory system will have excessive secretions. So in order to liquefy the secretions, in order to just remove the secretions, nebulization is important. So here the key of the question is, what is a better time for performing chest physiotherapy? Chest physiotherapy, it is necessary to mobilize the secretions. Okay. Why do we provide nebulization? Nebulization, it is to liquefy the secretions, and chest physiotherapy, it is performed to mobilize the secretions. Okay. After liquefying the secretions, we need to mobilize the secretions. Clear? So option 1 says continuously during the nebulizer treatment. That is not really perfect answer. So you can remove the first option. So it is not the correct answer. Second, prior to nebulizer treatment. Usually, chest physiotherapy will be only effective when it is performed after 15 minutes of nebulization. Okay, I repeat. Chest physiotherapy will be only considered as effective which is only performed after nebulization, because when you give nebulization, it liquefies the secretion. As a result of that, already the entire secretions become liquid or it's thin, and then when you perform chest physiotherapy, it always helps to mobilize the secretions. Okay, so prior to nebulizer treatment, it is wrong. So I have removed 2 options, and third option here is after the nebulizer treatment. That is really a perfect answer. So we can select this as an answer, and we have to confirm the other option is also wrong. So move to fourth option, intermittently during the nebulizer treatment. So that is also not the correct answer. So I have removed 3 answers, and we have selected the correct answer as after the nebulizer treatment. Okay, so please remember, chest physiotherapy, it can be performed after nebulization, that is 15 minutes after nebulization. Then only it is considered as an effective thing. Clear? Okay, so next question here it is. Next question is, while caring for a patient with ineffective airway clearance related to increased mucus production, the nurse should encourage fluid too. So, what is the meaning of this question? A client is admitted with any of condition, whereas the nursing diagnosis is ineffective airway clearance. Okay, so what it is indicating? It is ineffective airway clearance. This is the key here. So, what does that mean? Ineffective airway clearance, which means the respiratory tract is not clear Because of our secretions. Look at this picture. The secretions are accumulated, mucous secretions which are accumulated inside the respiratory tract, and that is causing the respiratory tract block. Okay, and this is the basic physiology which is expected in majority all of the respiratory disease conditions. It can be expected in asthma, it can be expected in COPD, many more conditions. Okay, so based on this problem, because of ineffective airway clearance, the appropriate intervention that in the question they have selected, it is encouraging fluid. So why do we encourage fluid? In order to treat or reduce ineffective airway clearance. Number 1 says maintain nutrition, as we know that hydration is not increasing the nutrition. So you can remove first option. What second says prevent boredom. It is really a wrong answer, so you can remove that. And third says stimulate coughing. See, hydration doesn't directly increase the coughing. So sometimes we get confusion, but still it is not the correct answer. And the correct answer here is thin secretions. Okay. So why hydration is important? Hydration is really necessary to thin the secretions. In the previous question we said nebulization is important. So now I would request all of you to write down a particular keys, that is pulmonary toileting. What is pulmonary toileting? Which means keeping the pulmonary tract clean. And what are the points that is included in pulmonary toileting? Number 1 is hydration. Why do we hydrate the patient with a respiratory disorder? In order to thin the secretions. Okay. Remember, basically in respiratory conditions, in order to fight against the respiratory infections, usually respiratory tract produces secretions. Okay. Inside the respiratory tract there is a cell called as goblet cells which produces secretions. Usually these secretions are produced inside the respiratory tract, but in case of respiratory infections or in case of any kind of allergic reactions, these secretions are produced excessively in order to fight against those kind of allergens or infections, bacteria, virus, many more. Fine. And whatever secretions which produces inside the respiratory tract usually has to expel out with the help of cilias. Okay. And cilias are the small hair-like projections which is found inside the respiratory tract that usually helping to propel the secretions out. Fine. So, because of some damage of cilias or because of any kind of respiratory infections or any respiratory problem, usually the secretions will be produced and it is not expelling out. So, it gets accumulated within the respiratory tract and the secretions will become thick. Okay, initially at the point of secretions, at the point of production of secretions, it will be very thin, but as soon as it starts accumulating over there, the character will turn and it becomes copious, thick and tenacious secretions. Okay, when the character turns to thick, the ability to expel out will be reduced. Okay, so that is a basic reason where the secretions get accumulated, and it ultimately reduces the pathway of respiratory tract. So we have to thin the secretions by hydrating. Okay, so what are the points that is included in pulmonary toileting? Number 1 is hydration, number 2 is nebulization, and number 3 is chest physiotherapy, number 4 is deep breathing and coughing exercise, number 5 is postural drainage. I repeat, number 1 hydration to thin the secretions, number 2 nebulization to again liquefy the secretions. Number 3 is chest physiotherapy in order to mobilize the secretions. Number 4 is deep breathing and coughing exercise in order to remove out the secretions. And the last one is postural drainage, that is usually enhancing the secretions to move out by giving different positions. So the correct answer for this question is thin the secretions. I hope you understood everything. And we will discuss more and more questions in the next video. Thank you for watching. God bless you all. And in our regular live sessions, online classes, we discuss all of the questions which is frequently asked for exam. And apart from that, we discuss topics. So after learning topics where you practice the questions, it will become more and more interesting and your confidence will increase. Thank you for watching. God bless you again. Thank you.